Okay, so up next again we have David. So thanks, David.
She's back. Are there anybody in the crowd? Can I just run this as usual, or do I need to do something wacky?
You can run it as usual. You should be able to.
Okay. I like doing wacky things, though, so. Got it. Thank you. Is there anyone in the audience who does what we might call online outreach to gay, bisexual men, either like as a volunteer, a nurse, a part of an agency? Awesome. This one's for you. Okay, so this is also from the Cruising Count study. I mentioned before that we had the online survey, but we also spoke to people who were providing online outreach to ask them about their experiences with online outreach. So I do want to thank, I actually am replacing Rusty Suleimanyov, who's a PhD student working with me, some of you may know, who couldn't be here, so that's why you're seeing me twice. I'm not that like ego-driven, a little bit, but you know. Same amazing team with a lot of amazing folks from across Ontario and Toronto in particular. So that's all the boring stuff. An amazing advisory board, including Jamie Wu, who wrote the book Meat Grinder. I don't know if people were familiar with that book from a few years ago. He was amazing, and an incredible staff. So basically, the qualitative arm of the study was really to kind of understand what the experiences and perspectives of those of you and others who were doing online outreach for gay and bisexual men in their communities. We wanted to understand some of the facilitators of and barriers to effective online outreach work, and identify existing evaluation practices, so much as they exist, to kind of think about how we know whether this works. This whole study came out, you might have noticed that the actual research team is, the two academics were myself and Nathan, actually a third, Simon Rosser from the University of Minnesota, who advised us. The rest of the team were all community providers. This was a study that really came from the community that said, we're out there doing this work online, we're running into all kinds of problems, we have no idea if what we're doing works. Can we figure that out? And I thought, wow, that would be really hard to actually completely, totally evaluate, but we can start somewhere. And so this is where we started. In order for people to be involved in this arm of the study, they had to be 16 years of age or older, currently providing online outreach services to gay and bi guys, or be interested in planning to provide, but not currently providing, or formally providing and not planning. Again, everybody, because we wanted the experience. There were agencies where they used to do this amazing online outreach, and then that person left the agency and the program disappeared. So we wanted to know what their experiences or ideas were about this concept. We did all the interviews in English, and people, of course, had to provide consent. People were interviewed for 1 hour. We had a semi-structured interview guide. We did a thematic analysis, which I'll explain the result. I'll share the results in a second. And again, as I mentioned, trying to get their experiences and perspectives. We asked them a little bit about what are the organizational structures or support for this kind of work? Are there policies? What are the capacities, opportunities, barriers, and challenges? And to ask a little bit about how they evaluate. So we had 22 interviews. The interviews were done primarily in the in Ontario, but outside of the GTA. But we also had people in the GTA, and we also included 4 interviews with people from outside of Ontario, including in BC, in the US, and 2 other places which I'm not remembering at the moment. 4 of the participants were public health staff, and the other 18 were people who were working for an AIDS service organization or a community-based organization. 18 were frontline workers, 2 volunteers, and 2 managers. So this is kind of an overall chart of what our findings are, and I'm just going to kind of take you in a big circle and make you super dizzy. You're welcome. So we asked why online outreach, or online in-reach, whatever, is important. And basically, one of the biggest responses was, this is where people meet now. It's the new community. There's no gay community physically out here anymore, unless you want to go to clubs or bars. So it makes sense for organizations to step up and be where everybody is. By the way, the little pieces, oh, sorry. How come that's not up there? That's odd. Okay. This was spoken by one of the urban aid service organization providers. You'll see a little bit on the lower right-hand side just to give you a sense about who is saying what. GPS location-based smartphone apps are really kind of helping people to connect and find sub-communities as well. So some of the goals of this kind of work are, it's really the creating community. And then there's finding the guys where they're at and making ourselves available so that we're there when they do have a question. Ideally, the purpose of doing online outreach for us is to reach guys we wouldn't normally or necessarily be able to reach in our usual methods. And it's very crucial to those who are not getting information and are not connected to the right communities that they need. So things like getting testing or just navigating the coming out process. So we then asked people to talk a little bit about the strengths of online outreach. Let me know if this resonates with some of you. I think some people might be less comfortable talking to a stranger in person, but reaching these guys is one of the biggest strengths I would see, one of the main benefits of doing this way. We try to do it as a team and always try to link people to an online resource in every conversation. Even if they forget what we talked about, they would have that resource in their chat feed if they'd like it. The strength of it is just the availability, building recognition that, okay, these people are from such and such agency and I can ask them a question. That part is good. The availability and the fact that people are cluing in and that they can just go ahead and ask us a question. I think that's working well. And a public health provider said we're trying to capitalize on the fact that we're not volunteers or we're not in the role of an ASO, we're actually healthcare providers that can answer any questions you have about sexual health, HIV, STIs, or testing. So the public health folks are really very specifically talking about, we have nurses that can answer very particular questions. I think that's important. So we also asked people, what are the weaknesses, the challenges, or the opportunities to grow? And some of the important comments were that we're working with the app providers. I can't make my joke because it's being recorded, but I'll make it later if somebody wants to hear it about that. So the biggest issue has really been, for example, on a particular website, on a message board, you can't post contact information, so it can be a little bit confusing for volunteers because we're on different sites and there are different rules on different sites. So part of the issue with online outreach is having to navigate and negotiate terms of references, having your site shut down, having your outreach shut down every month, and how to kind of work around that and what are the possibilities. One of our biggest fears is that we rely on the site administrator to allow us to be there, and so there are certain rules, and every once in a while someone might make a mistake, and they always have this control over you, like we can take away your membership. Basically, figuring out how to use these apps because I don't have any more money in my budget to do ads, which are expensive, if anyone has ever tried to pay for ads on these apps. Another organization had money in their budget to do this kind of work. The other thing is that these apps pop up like crazy. It's difficult for one guy to stay on all these apps and incorporate all the different kinds of possible apps that someone might be doing. How do you do all that work in a 7-hour workday? It's impossible. Sounds like an interesting workday, but it is impossible. So what are the skills and training that was required for online outreach? Cultural competency, handling people when they say really stigmatizing things, an extensive knowledge of the biology of HIV, lots of questions about that. Being flexible, the communication style might need to change based on the person you're speaking with. The training module that this organization does covers things like personal safety, assertiveness, boundaries, emotional intelligence, etc. And also having feedback and supervision for people who are providing this kind of work. Then there's lots of ethical issues. So actually, the people who are doing this work talked so much about ethical issues that we actually separately wrote a paper that is just about to be published within the next month or two with BMC Medical Ethics. And it's an open access, so I put the citation there because it will be accessible to anybody. Lots in there, so I'm not going to focus too much on it, but I will address these 4 points. Boundaries, like where do I end and you begin, and vice versa. Am I allowed to talk to you on this app and then hook up with you later or right now? Or what if I did before? Those kinds of issues. Confidentiality. The chat that you're having with someone on an app is not just your private conversation with them. That information is caught by the app provider. So is there any possibility that somehow your confidentiality could be compromised? Disclosure of one's own situation, being in a partnership, being positive, being on PrEP, any of those kinds of things that might create some challenge. Even do you disclose your real name or anything about yourself? And then security and safety. So some agencies were doing things like changing the GPS location because they were fearful that people would actually come and try to find them. I don't know the details of that story, but so those are some of the ethical issues. But again, there's a lot more fleshed out in our paper. Prevention tools and resources. So we ask people, like, what do you use? And they say we go to websites, GMSH in Ontario, various campaigns, the sexyouwant.ca campaign, so that we can just, again, pass the link on. There's a mention of SHARE, which is the old sexual health Educators Internet Resource Guide through the GMSH, the Gay Men's Sexual Health Alliance in Ontario, which has been redone as a result of this Cruising Count study. It's now called the Cruising Counts Guide, and it is accessible online. If you just enter Cruising Counts Guide, you'll be able to find that through Katie or through the GMSH. So that was published about 4 months before Grindr appeared in Canada. And Grindr changed everything, right, in so many ways. So. Okay, in terms of evaluation, the overarching theme is really highlighted here. We don't presently evaluate it. We're not a funded program. We don't have to detail our evaluation requirements. Indicators for success is whether or not we're able to answer a question properly. We have to fill out reports. Providers in Ontario have to fill out reports. So it's kind of statistics. Are we getting the right kinds of questions? Are we figuring out exactly how we can make sure we're answering those questions? So there was a lot of frustration with the process of evaluation and how it could be evaluated. Because even the reports that they're required to do don't really get at what's actually happening in those online interactions, right? I bet I would see heads nodding if my glasses were less fuzzy. Okay, so in summary, this is the first study of its kind to examine gay bi men's online outreach from a provider's perspective. People commented mostly on the importance, the goals, and the context, and yet everyone talked about this as a really vital tool. Yes, of course, we have to be where guys are at, so if they're online, we really need to make sure we're there. They have indicated some uncertainty about how to do it and also to highlight the advantages. They were able to articulate a number of strengths and advantages: instant access, accessing hard-to-reach population. But across the interviews, you could really see the very specific elements that were barriers: consistent quality of service, collaborations between companies that own these technologies and outreach service agencies, as well as budgetary and staff capacity issues. So we think these findings can help us think about how we can support ASOs and actually bring some information to the app providers about how their services and their platforms could be used more for gay men's health. There has been a dramatic shift over the last couple of years, for those of you who might be doing this work, in this idea that the app providers have a sense of ownership for gay men's health a little bit more than they did a couple of years ago, but there still needs to be, more needs to happen, and it's part of the work that we're continuing to do. So outreach staff reported that there really are no official evaluations, and they would like to think about that. So some of the implications are that online outreach uses different venues for targeting gay men, and maybe we can play a greater role in the advancing of combination HIV prevention and care services by acknowledging and addressing these kinds of barriers. One of the things I do want to mention is this study was a very quick and dirty study in the sense that we really did it very we are following up this study with a study in Ontario called iCruise, which launched late this summer, where we're actually following guys. We're not following anybody, sorry. I need to be careful about how I say that. It's not surveillance. We are asking guys if they would be interested in communicating with us once a week about where they're going online, what they're doing, who they're talking to, their health status, their accessing healthcare and health information, their health literacy. It's quite a large study. We've actually recruited just under 600 guys already so far, and we asked them to stick with us for 4 months, 3 months of doing those weekly diaries, and a month before and after in terms of trying to get a sense about doing a baseline and then possibly being interviewed at the end about their involvement in the study. So if you know any folks in Ontario who are interested in being part of that study, it's called iCruise, and you can Google that and find it, no problem. Okay, so I particularly want to thank Rusty, because he's back home in Ontario, which, by the way, is the exact same weather that we're having here today. So I feel a little gypped in that way, ripped off, I guess. So anyway, but I want to thank Rusty, because Rusty was really helpful in putting this work together. So thanks.